Good afternoon. We'll call this meeting of the Personnel Committee of the Fiscal Court to order. Madam Clerk, will you please call the roll?
Squire Gentry.
Here.
Squire Carl.
Here.
Judge Kett.
Yes, ma'am. All right. The first item on the agenda pertains to the Jack Jewett House independent contractor. I've talked to Mr. Lewis, and we're not prepared to move forward with that contract at this time. But that will be something hopefully will be revisited by the court. The next item is, you all know that we have 2 open animal control officer positions for full-time. Emily Katner is the only full-time officer, and Cameron Filger is part-time at this point. And so we really need to recommend that we open that position, advertise, and begin the hiring process for a full-time animal control officer. Is there a motion to recommend that to the full fiscal court?
Motion.
Motion by Squire Gentry, second by Squire Carl. Are there any questions? Seeing none, all those in favor, please vote and signify by saying aye.
Aye.
All those opposed, nay. And the motion carries. The next item, as you all know, we had an assistant tax administrator position open. We advertised, we interviewed, and we approached hiring, but we were unable to complete that hire. One of the issues is that that position probably needed a little bit more pay, frankly. And so we've looked at creating a assistant tax administrator and human resources assistant position. That would meet a couple of requirements that we have. One, that we're doing our best to collect on delinquent taxes, follow up with those that haven't paid their taxes, assist Eddie Mattingly and the treasurer in that role. But we have nobody that is completely dedicated to back up HR. We spread that around in those responsibilities. And Teresa and I have really discussed the idea of creating an assistant HR position that could be a backup for payroll in particular. If the worst came to worst and Teresa could not be here for payroll, we would be doing that piecemeal, and that's not something we want to work on that way. We want someone to be dedicated to step into that role. And then there's a lot of other HR opportunities that we could use the assistance with. And if we had both a tax administrator and HR assistant, I think it would really be beneficial in meeting the needs of both the treasurer's office and our human resources manager. So you all have seen the proposed job duties and descriptions for this new position. It would be a new position. It would be in the treasurer's office. It would essentially take the role of the assistant tax administrator. It would be in. It would take that position, and we would no longer have that position. This would replace it. And we've added just some additional HR duties. So is there a motion to adopt the job duties and descriptions for a assistant tax admin and HR position? Motion by Squire Carl, second by Squire Gentry. I'd open up the floor for any discussion that you all have. Is there a motion to recommend the advertising and hiring process for that position? Motion by Squire Gentry, second by Squire Carl. Anybody else have any questions or comments? Seeing none, all those in favor, please vote and signify by saying aye.
Aye.
All those opposed, nay. And the motion carries unanimously. The next item is we have a personnel order, specifically a driver position recommendation for hire from the road supervisor. We would want a recommendation from the personnel committee to for the full fiscal court to approve the personnel order as presented. Motion by Squire Gentry, second by Squire Carl. All those in favor, please vote, signify by saying aye.
Aye.
All those opposed, nay. And the motion carries. So we'll move on to the draft EMS pay proposal. As you all know, our budget has two main components. It has your operations line items and your personnel line items. And all personnel line items of any significance will go through the Personnel Committee for a review. And that's where we are with the EMS pay proposal that was sent out for this court meeting and for the budget. So the process would be that we would work through vetting this pay proposal, taking input from the Personnel Committee and then the full court. And my goal is to introduce that in the budget that I will present to this court by May 1st deadline. So we have Director Bailey with us. Director Bailey, if you would, please come and share the information that you have worked so diligently on for the pay proposals for our paramedics and EMTs.
Thank you all for giving me your time. I've been working with HR with Teresa over this for several weeks and months now, trying to establish what the pay is around us. And the reason we did this, this wasn't on our radar in the beginning. But for the last 8-9 months, I've had job postings on Indeed and social media and by word of mouth to multiple people trying to hire our paramedic for the new Midway station. Not really the Midway station, it's the third truck that we are running and currently keeping busy. And we've not got a first bite off of that posting. We list our benefits, we list our salaries, our starting salary at $53,000, and we've not been able to pull anybody in. We've talked to multiple people that's come down and asked if we could increase that money and get it up more competitive with what was going on in the market, then they would be very happy to come. I've got several that have contacted me and said, hey, look, I'm interested, but I just can't come for that kind of money. Can't. So I thought, can't be that far off. So I got with Teresa and we started researching. We went on to social media, pulling off all the posts and things from agencies that's been posting. We've went on Indeed and pulled all the Indeed advertisements for EMS of what they were advertising at and what they were hiring at. And then we also started to compile the numbers from agencies around. I work with the Bluegrass Coalition, which I chair the EMS side, which hosts 17 counties that are around us that touch us. So I've talked with all 17 of those directors to find out what they're doing, how we're doing this. Our problem is there is a massive shortage of paramedics and EMTs in the field. The only way we stop this bidding war is by putting more medics and EMTs out in the field. You got to have a more supply than you do demand. And right now it's the opposite. So that's why all these counties are doing what they're doing to fight this battle. They are having to increase their rates more than what they really want to, and some more than what they really can afford to do. But they're doing it to keep their staff, to keep them in. We have had a very old service for quite some time because when people come, they don't leave. Those people all have retired and are gone. I have all new staff on the spreadsheet we sent out, and over 80% of my staff is 4 years or below. So those people are looking for the money. They're not looking for the retirement. Used to, when you was in Tier 1, you got 20 years in a service, you was able to retire and have a decent salary, but your benefits was paid for you and your spouse or your family. That's not the case anymore with these young ones. In Tier 3, they got to work 27 years plus their age, and then they get $15 a month for every year that they worked to pay for their insurance, what doesn't add up to very much at all. So they're not looking at the benefit of the hazard duty retirement anymore. That's not a draw. What they're looking at is what money do I get to take home every week, every 2 weeks for my paycheck to cover my cost of what it is to raise a family nowadays. You know, because they do the same thing we do. You know, when they go to the grocery or go to the gas station, it costs them the same as it costs us. So they're looking at who's going to pay me. They're not looking at the retirement. They're not asking about the benefits. They're asking, how much am I getting paid? And I've had several that have come in. I know that looking at the reports, because me and Teresa's done the whole gamut of venting this. We've contacted everybody. We've pulled it. We know that we've done adjustments. I've had them actually call me and ask me about where we made adjustments. And, you know, your service still has a lot of turnover. It does. And it's going to continue to do that because it's about what is today, not what was 2 years ago, but what's today. What's today's market bearing? What are they paying? So when we did that, you all got the spreadsheets that we sent out. You got the supporting documents that shows that what we're doing, to where you don't think that we're just telling you, hey, look, we need to do this. I mean, we've shown you that what's there. All I'm trying to do is project what the future is going to be. If we don't make adjustments, they're not going to stay. It's not that they don't want to. They're very happy with what they're doing and where they're working. But at the end of the day, for a brand new paramedic or a brand new EMT that comes in here, it's how much can I make for my family? And as you all seen on these charts, you know, some of them it's $4,000 or $5,000, $3,000. Some of them it's 10. So that's a big difference. And that's the reason I've presented to you what I have. We hope to shut down that revolving door by raising this up. I think once we get to that level, it's going to help us tremendously. It's going to help us with drawing people in. In my proposal, you also seen where we've asked to change some of our benefit package that we do. Also add the benchmark, which is at 5 years, 10 years, 15, 20, and 25 years, to try to continue to support those people, to keep them here, give them a reason to stay. And a lot of the services out there have went to that, to increase that. You know, to make a difference with them, because they're all competing for the same people that we're competing for. They're calling my people. There's a lot of services that are paying the fee and calling the Kentucky Board of EMS and having them give them the full roster of every paramedic and EMT in the state, and they're doing mailers to them. They get emails sent to them. They get papers in the mail that come in their mailbox that says, hey, this is such and such county, here's our benefits, here's our things, we'd love you to be part of our family. So, I mean, it's a very competitive market right now. That's what we're up against. It's not that, you know, it's not that I want to have to stand here and do this, it's just a necessity. It's my job to keep you informed of what's out there, what's going on. It's just like, you know, we try to do that. The other thing is we wanted to try to change their accrual of how they get their vacation time. For our guys working a 24-hour shift at 8 hours, it takes them 3 months to get 1 day off. We're asking to increase that by 4 hours on that, take it to 12 hours to where at least 2 months they get 1 day off. Our job is very stressful. These guys have seen and done a lot of things that nobody should really see or have to do, but it's what they do, the career they choose. It's very stressful, so we like them having a time off to get off work to be able to go do. So we've asked to change that to where it would be, you know, for 0 to 5 years, they would get 12 hours a month. And then from 6 years to 12 years, they would get 16 hours a month. And then from 13 plus on, they'd get 20 hours a month, just in that. The other thing that we'd like to do is the 6 months that they're not allowed to use their time, and this is more of a personal request for me and my assistant, Kent, is take away that 6 months that they can't use their vacation time. Allow them to schedule those times as it comes up, because what happens when we do this, where all of them are so new, they don't get their time to the end of the year. Well, all the holiday comes at the end of the year as well, the bulk of the holiday time. So now I've got 15 people coming into our office wanting to schedule time off, because we're trying to maintain that 96 hours. Well, now they're all coming in at the same time, trying to get off. Well, I can't get them all off. So that's why you see the hours a lot of times come over top of that number, over the 96 that they can carry over in that line item. And it would just help us spread that out more. It's also a good benefit for them to come in and work. You know, so that's the other thing that we've asked to do with that, to try to, again, sweeten the package up the best that we can to give them, you know, the basic same benefits, just changing a little bit to where they get to use it and work it, to where they can schedule off, they can be away. If you went through the package and looked at it, there's a lot of services that are doing years of experience. We didn't add that in because that adds a lot more money. I mean, some of them are paying 1.5% for up to 10 years. So that's 15% of their base pay that's an increase. There's another county or two that's doing more. One of them does 3.5% up to 10 years. That's 35% of the base pay. There's some of these in here. Hopefully it's not very, too confusing for the way I made the chart, because it's actually two graphs when you look at it. If you look at the first boxes on the left-hand side, that's all of our employees and what they make currently and what their years of service are. If you look at the graph on your right-hand side, that's all of our surrounding counties and what hours they work and what money they are being paid and what extra benefits they're adding. It's like Anderson County. They pay for any extra certifications they get. So if it's our general rescue, they get additional money for that. If they're a CPR and a ACLS or a PALS instructor, they get more money for that. You know, everything that they do over there, they increase that a little bit as they go. And then like Georgetown, we have got in the state, we have been working diligently trying to get the CLEF money passed for EMS, which is a training incentive that the police department and fire departments get. That's $4,300 last year that the state contributes. Doesn't cost the county anything. We're trying to get that for EMS to where it helps increase the salary without having to keep coming to you all. But we haven't been able to pass that. Well, Scott County decided to go on and put $3,000 into theirs and call it an incentive for them, a pay incentive for their training, to be able to use it for training and things. And then if the state comes through and we get that passed eventually, they'll take that away and the county won't pay that $3,000. Then the state will be paying the $4,300. So it doesn't hurt the employee, but they get it. They also, if you look, they added 10 cents a year for their longevity, up to 10 years, so $1 on the hour more. And they also, as an extra incentive to try to keep their people happy, they added $3 an hour for any overtime they work above their regular overtime rate. So they're doing everything outside of the box to try to keep their staff. And that's what every EMS service in the state of Kentucky is doing right now, is trying to go outside that box to keep their staff, because they know every one of us is trying to hire their people away from them. And that's what we've been trying to do. And again, for the last 8 months, 9 months, we've not been able to do that. And so we started asking. Another instance that it was, one of our EMTs came in. We had hired him. He came in. We brought him in, set him down. We was with Teresa in the office working the payroll or the benefit package with him. And he asked us then if we could negotiate the $40,000. He said, "Can we increase that money? Because I can make more money elsewhere." And I was like, "It's a little late now. And, you know, we hired you at this rate because that's all we pay right now. That's what our standard rate is. We can't adjust it outside of that." And so, you know, you immediately, when you're having that conversation with them, you know what that means. They're coming to get their experience because he's brand new. He's coming to get his experience and he's leaving. He's going to go somewhere that he makes more money. And that's what we're trying to do, is stop that revolving door issue that we have. We have a lot of employees that have retired, that have come back to us working part-time. We've got a couple of them that's done that. We've got several of our full-timers that left us to go to work for CODA. I had 2 leave me for CODA because I can't compete with CODA's pay. They're making $75,000, $80,000 a year to harvest organs. And they're not doing the harvest, they're just doing the paperwork, talking to the families. But they stayed part-time with us because they love where they're at here. They just needed to be able to support more money for their families. I've had others that have left us to go to other counties to make more money, but our part-time pay was good enough that they stuck around to help the best they could, because we was proactive with that. We went ahead and did something that the other counties didn't do, and now all the other counties are catching on and they're starting to pay what we're paying. We're good with our part-time rate. We're not asking to change it. We didn't ask to change our salaries, Kent's or my salary, either one. It's strictly the employees. It's just try to keep what we have here, and be able to draw more people. You know, and again, Teresa and myself sat in her office, and the bulk of this, probably 75% of this left. We sat in the office and called and put them on speakerphone and talked directly with their directors to confirm what we were putting on paper was accurate. What we was pulling off the internet and off their web pages and off of Indeed. And everybody confirmed the numbers that we had. Some was higher than what was advertised, than the printouts that we had. Because it's a changing target every day. So that's why I'm bringing this to you and presenting it to you. It's something that if I did not bring this to you, I wouldn't be doing my job. Because my job is try to maintain the best high quality people for Woodford County that I can. We've got the best paramedics, the best EMTs. They work hard, they train extra, they do more. You know, if you look at their timesheets, they're not as afraid to work. I've got them working 155 hours in a 2-week period. I just had one turn payroll in this week, 155 hours for 2 weeks. This has become their part-time jobs. Because across EMS as a whole, every EMS worker out there for the last 30 plus years has had to have 2 careers. They couldn't work one full-time job because it didn't pay enough. So that's what they've done their whole careers. The young ones coming in has figured out that's what they're having to do. Now the market is going up because of supply and demand. And that's the only reason we're here today, again, representing this to you after, you know, just a little over 2 years. But that's what it's changed that fast. And I'll be happy to answer any questions that you might have about it.
Well, thank you, Freeman. And so the one thing that I want to start out by saying is that when you talk about salary comparisons and you all doing your research and your homework and looking at other departments and agencies across Central Kentucky, but even outside the Central Kentucky region, you provided what I would consider a more than adequate sampling of comparable rates across the state. I know how much you and Teresa have put in the work to figure that out and provide the receipts, which we have sent out as part of this package. You did all that work, but the reality is that you live this. You know how much pay is going up, and it's been going up since COVID. When we moved our part-time rate up, we were at the head of the class. We were at the top of the pay scale for part-time EMS employees in the state. That's not the case anymore. If you look at the pay proposal, we like the way that Shelby County arranged their pay proposal so that it was very simple for the public and for their magistrates to understand. So we've kind of used their template in setting this forward. One of the things that I think is very telling is that the EMS director will reevaluate the pay scale every 2 years and present it to the Personnel Committee for approval prior to submitting to the fiscal court. We anticipate that in 2 years that we're going to have to look at this again. Not 4 years, not 10 years, in 2 years. And reason being is that's the nature of the change in emergency medical services. And it's the same with nurses, it's the same with medical technicians, it's the same across that industry and field, and a lot of it is due to the demand. It's a high demand, and there is a shortage of paramedics and EMTs. That's something that we, in our last fiscal court, when we did raise part-time salaries, we went over and we talked about that shortage. And so I just want to go through and discuss the particulars so that everybody can understand it. But it's moving an EMT certification up to $52,000. A paramedic certification to $62,000. And we already have the supervisor pay at additional $5,000 on top of your base. Freeman has recommended this benchmark adjustment to help with retention. This whole proposal is about retention. It would have 5-year, 10-year, 15-year, 20 and 25-year benchmarks with a 2.5% increase upon reaching that benchmark. Again, you can look at these bullet points, but if someone is to quit or retire or get rehired, their incentive pay would reset to the base salary. You know, there's some question about whether or not we should do that, but I think that's a cost-saving mechanism. And if it's about retention, we want people to stay, and we want them to know about that. The benchmarks are added to the base salaries for the employees. The increases will be effective in the second pay period of the month for each employee who hits the benchmark. Full-time EMS employees will receive the COLA given to all county employees on each fiscal year added to their base pay, which is what we do now. And again, I mentioned the reevaluation. I think that's really, really important. I think it's important to manage expectations. Not only are we here right now, it's conceivable that we'll be here again in less than 2 years. It's the responsibility of the director to notify the HR department of all the changes in pay. The good thing is Teresa is on top of all that. The 1-year rule that you all know that we implemented is very, very detail oriented in how it's applied and made sure that it takes effect in payroll with a lot of different moving parts, and Teresa does a tremendous job with that. And so while her and Freeman will work together to make sure that all of these things are adequately incorporated, you all also know that all personnel orders reflect any personnel changes, and the full court has to vote on that anyway. The big one, I believe, is the amending the vacation time policy, and Freeman set that out, and also changing the nature of the 6-month probationary period for vacation use for new employees. Just to share with you all, we were already looking at that vacation change for shift employees. We only have 2 agencies with shift employees. That would be the jail and EMS. But it is burdensome on shift employees when our vacation policy is clearly designed on an 8-hour day, an 8-hour work day. So they would earn an 8-hour day of vacation time, and then they could only take off, as in a 12-hour shift at the jail, 3/4 of a day, 3/4 of their shift. Wouldn't even match one day. This would help the jail employees as well, but it would specifically be a huge benefit to EMS employees who work a 24-hour shift, like you said, which would take several months just to earn 1 day off. The problem that we face is that these jobs are extremely difficult. They see things, they feel things, and they experience things that not many other people have to, and they do it on behalf of us and to save lives. And that takes a toll mentally, physically, and in the case of their time off provisions, it impacts their quality of life and their family life, the time that they get to spend away from the job. Somebody working 155 hours in a pay period is on a trajectory for burnout. And there's a lot of burnout. There's a lot of folks that are in need of mental health assistance, all sorts of some other things because of the nature of these jobs. To make working at Woodford County EMS more employee friendly, we need to make sure that if they have vacation that they can take it. The part-time pay increase that we did basically put a stopgap in between Freeman and Kent having to mandatory already overextended paramedics and EMTs. And that helped people step back, take a breath in a very, very difficult time, specifically COVID, when things were, the run volumes were through the roof. There was anxiety over the general nature of being around people, and they were in a small box with people every day making runs. Our Call volumes have only increased. Yeah, you didn't really mention that, but I think the fiscal court is well aware that our call volumes are on a trajectory that will continue to increase. And the goal of this pay proposal is to adequately compensate these professionals for the job that they do, and to provide them the ability to enjoy their life and their families with a package that understands and realizes that they are not like other county employees who get to go home at the end of the day. In fact, I've already mentioned this, they're the only ones that work a 24-hour shift, and that's difficult in and of itself. This is also making sure that we remain competitive. I know that Director Bailey believes that Woodford County should, and we are working towards having the best EMS service in the state of Kentucky. This proposal is a way to make sure that that trajectory is able to be realized. So, I'd like to open up the floor for discussion from the Personnel Committee on the pay proposal. Again, this is coming out way ahead of the personnel policy proposals of the budget, but that's because it is a significant difference. It's a substantive pay proposal that will increase our budget. That is absolutely true. But what I appreciate, Director Bailey, is that you've gone about it in the right way. You've provided the evidence, the research, you've done your homework. This isn't throwing spaghetti against the wall. You're not coming in high and hopefully we bring it up a little bit. This is right where it needs to be, in my opinion. It is. If anybody feels different, I welcome that. But I believe if you are on the ground, if you're doing the research that Teresa and Freeman have done, you're going to find the same things that we found, and that is that this is not going to make us the highest paid EMS in the state. It's not. It's going to keep us competitive, but it is not going over the top or giving out something that is not already earned and well deserved. So I'll open up the floor for discussion for the Personnel Committee. Squire Carl, you're recognized.
Absolutely. Well, I've spoken with Director Bailey in reference to this, and I'm very supportive of this. And I know that it's a need for the retention of these young people. And again, the retirement system has, let us down. I mean, it has. And that's not something that's going to draw these young people here. They need the money. We realize that, and they want to see it, and they know they can go to other counties, and we truly, and I know that as being a part of this court too, that I do want the very best for this community. I want the paramedics and the EMTs to be the very best. And I think this will help us, and we can't help the turnaround. Freeman, I know how passionate you are about this. I know that it's very personal for you, and that you want to do, you are accessible to this community 24/7. And I know how hard your people work. And again, if you're unsure what they do, then again, I know that Freeman will let you come out and ride with them anytime. And this is not a job that everybody wants to do, but the ones that have committed to it, they are the first of the first responders. These are the people that come in and save your loved ones and get them the care they need. And that's truly how this works. And whatever we can do, and we've had neighboring counties right now that have shut down, and they don't have EMS. So again, I know that they're trying to resolve that too, but it's this is a must. We have to do it, and I want to thank you and Teresa for your forward thinking on this. It's kind of putting this out there, and I know you're just putting this out there and putting it in our hands and letting us decide what to do. Absolutely. But again, it's something that we do have to look at as a court. We have to look at it, and it's something for our community that they might not fully understand it because they're not in it, but if they did, they would also want the very best. And we do have the very best. So let's keep them, whatever we have to do.
Thank you.
Thank you, Squire Carl. Squire Gentry.
Thank you, Director Bailey, Ms. Tipton. That's a lot of information that you gave us. I know how it is trying to keep people. I have a revolving door at work as well. It's not fun. I'm absolutely for this. It's a no-brainer. I mean, if you're against this, you might as well be against the police budget, because it's the same thing. I feel like you do a great job, and you're seeing what's coming down the pike.
Well,
I
and that's,
appreciate it.
appreciate that. We've tried very hard to keep all the costs down, as you all know. I don't spend money crazily. Every piece of equipment that we try to buy, I've never paid cost for it. I've always gotten it discounted greatly. If I could do that with this, I would, but I can't. I'm not in control of what the cost is, what other agencies are doing, what other counties are doing. As you was talking, Squire Carl, Mercer County closed down, and they're having to bring in a private service that doesn't have very many people. They're trying their best to hire people right now to fill those voids. I know that very personally, because I got 2 or 3 of my staff that live there that now are asking, can I take my medical bag home, because we know we ain't gonna have the help we need if something goes wrong. I don't ever want to see us there. That's why I'm standing here in front of you now. I know it's not an easy topic, but it's a necessary topic. It's something that we have to look at and meet face forward, because again, we're not in control of what the market's doing to us. It's the drastic shortage of paramedics and EMTs nationally, not just in Kentucky, but everywhere, is extremely bad. And we're losing people left and right. So, you know, we're doing everything we can. I've started the program at the high school to try to draw in those. We've got 2 high school students that are brand new, 18 years old, that we're working with and teaching, that have graduated the EMT program. They're here working. They live here in the county. They're invested in our county. But their ambitions is to be doctors, you know, so they're in school, but they're going to work for us. They're going to be here. They're helping us. We're doing everything we can. As I told you, and the only way to solve this totally is put more people out there than the demand needs. And that's not going to happen overnight. That's going to be a 5-year, 10-year battle. And every director in the state of Kentucky is on that battle with me. We are all pushing in the same direction. I started leading the charge day one when they changed the accreditation process. You know, when they changed it to where you had to be accredited through a college to host a EMT or paramedic program. You had to, for a paramedic program, because they was trying to push the cost of paramedics up to where they'd make more money to keep them in the industry. And I was against it then, because it was going to do what it's doing right now. We didn't foresee COVID hitting us to even compound that problem, but it is where it's at. I've talked to some of you all on the phone, and I've encouraged you to talk to other people, other magistrates, other courts. They're all going to tell you the same thing. They're fighting the same battle. You know, we're all chasing each other's people, because there's only so many of them coming out. They're not producing very many each year. And that's what we're trying to do. So I appreciate y'all at least looking at the proposal.
Absolutely. And to Squire Gentry's point about the police budget, I really appreciate the way that this has been handled, in that we're moving it through the budget process. We're, you know, we're providing opportunity for input, for discussion, for, you know, you've got, I don't know how many, you know, actual advertisements for paramedics and EMTs that you can say this is on Indeed, and they're recruiting people with the promises of this salary or that salary. The KCO salary survey is great. It's a really good help. It has a lot of comparable data, but it doesn't have this level of detail. The level that you all have gathered and garnered is it's literally real time. It's what's out there right now, and you know, this would go in effect obviously July 1 in the budget. It'll be measured against the budget as well, and we'll have the opportunity at that point to see it when I present my budget. You'll be able to see it as positioned within our budget, and what you're gonna see is that we're gonna be able to afford this. Because we have been conservative, because we have controlled our spending, because we have been good stewards of the taxpayers' dollars. You're going to see that we can afford to make this investment if we have the will of the court to support our paramedics and our EMTs. So, I'd open up the floor for other members of the court outside of the Personnel Committee to have any questions or comments. Any members of the Personnel Committee have anything additional?
Just once again, thank you very much for all the information. I know it took a lot of time. Appreciate it.
Anybody else have any questions? Comments?
Okay.
Yeah, and I encourage folks to touch base with, this is for all department budgets. Talk to the director, talk to the person who's working on the budget. This is obviously a personnel line item issue, so if you have questions, one thing I would say is that if you have a question, that it's probably a question that your colleagues, others may have. So when you have a request that whatever information you're asking for is produced for the whole court. I may just, any requests that come by, I may try to do that, just because, I mean, that's how this works. So the more information we all have and share together, the better. So, but, you know, Director Bailey, if you're getting similar questions from individual magistrates, you know, let me know, and I'll make sure we can provide everybody with the answers that you're going to give, and
Absolutely.
we can go through there. I am working on, and I have provided the personnel orders upon request for the past 2 years, and you're going to be able to see the turnover. You can see all of our personnel actions that way, but you all had those each and every court, but you'll have them as a packet, so you can individually look at the turnover for any questions about retention. Director Bailey, do you want to touch on just briefly you've mentioned some of the specific instances, but if someone says, are we really having this type of retention issue? I mean, that we need to increase the pay.
Sure. You know, as you all got the turnover rate is in there. There's a lot of them. Again, you know, I can tell you individually, every person. And we have their resignation letters as to why they leave. It's never that they're not happy with the service or the call volume. You know, we're over 4,000 calls a year now. And it's because of money the bulk of the time. Again, we're not going to ever compete with CODA. We're not going to compete with UK Hospital. But we have no choice but compete with other county agencies, because that's where these people are going and what we're doing. A lot of my retention is, you know, I'll keep them on the roster for 6 months or more or a year. If they don't work, if they can't pull hours and help us because their full-time jobs is keeping them busy, then I remove them from that list and add more back on that list. And that's where that revolving door comes from. Because it does me no good to have 25 of them on the list and only 3 of them working. It's time for me to move them out and bring more in to try to work. Even at $28 an hour, $29 an hour, you know, if their full-time job is mandatory in them to work, they're not going to come to me and work. They can't do it. And then when they work mandatory hours at their other job, they're not going to come to me on the 2 days they may have off that whole month to work. So once they do that, I send them a nice letter and tell them that, hey, we understand that life happens and sometimes we get extremely busy and we can't use you that you can't provide us the hours that we need. Because the only thing we ask them to do as a part-timer is to work 48 hours. We tell them 24 minimum. Just do 24 hours a month for us. Because when you got 18 full-time positions, we're not like any other department that can, if you take off work, we don't have to fill your spot. Every time that person takes off, I got to have another person put it back in that spot, whether that's full-time or part-time. So that's what we're doing. You know, again, the people coming and going, the young ones. You know, I've got, like I said, some of them that's retired that's come back. I had Chad Ford, great young man. Comes in, works with us. He retired out after 20 years. He went to the hospital, done their thing. He came back part-time with us. He worked part-time and decided to go full-time. He went full-time. We had a taste of over a year of being off of that 24-hour shift. And after working that 24-hour shift for a little while, he figured out he didn't like it. He's like, I'm going back part-time. I can't do 24 hours. He said, I just can't do that shift anymore. I get it. I understand that. It's hard on these guys. And for me, the one thing that I do is I never forget where I started. I started on that 24-hour shift. I started as a rotator. I took and worked any shift that anybody was off when I first came in. And then I went to the 24-hour rotation, and I did that for 30 years, 25 years. And it was okay. I got used to it. But when you get off of it, it's tough to come in. When I come in and fill a 24-hour shift now to help the crews out when we're short-staffed, it wears me out. It takes me 2 or 3 days to try to catch back up. Could be that I'm old, but it's the fact that that is a tough rotation shift for these guys. And I get it. But again, you can see the numbers. You can see the reason they leave. Again, we've got their letters as the resignation is why they leave. We do an exit interview with every employee. We ask them why they're leaving. Some of them, I've had several come to me in tears, privately in the office with me, crying and saying, I can't do this job any longer. I'm not old enough to retire, but I can't do this job anymore. I got to get out. I get that. They're seeing things that other people shouldn't see. They're doing things. And again, the money thing is only because of supply and demand. That's the only reason we're asking for this. It's not because we think that we should be paid more than a nurse or as much as a nurse or, the nurses are fighting the same battle that we are. The doctors are the same battle. But better yet, right in our own county, our fire departments are fighting the same battle of trying to have that retention. Our city fire department fights it daily. Our county fire department has the same thing going with them. And our police department had the same problem. So it's, I'm not bringing you something new. I'm just trying to be able to present this to you well enough in advance that we can prevent it from happening to us.
And I believe the Woodford County Fire District is looking at double figure increase for full-time firefighters.
They have. I spoke with Chief, but I told him I would not reveal that because they're in works with that now. Hasn't been approved. There's been trying to get it done because he's got the same thing. He's got people looking for other jobs because they're paying more. They've done the same thing I did, the studies. We all do them. We have to. Because we want to keep the staff that we have because they're really good at their jobs. They've made the difference in a lot of lives out there. And we want to keep those people. We want to keep them here. We've got some that's moved here. They're invested. They love our community. They love our county. They love our court. That's half of the draw. Is we got a physical court that backs our county employees. Not just EMS, but every county employee. And when you have a county and a court and a judge that backs you, it's a draw. Because they'll ask those questions when they come in. That's part of when we ask them if they have any questions, how's your court support you? Because they come from other agencies that court may not support them. And so that's part of our draw. But I encourage anybody that has questions, call me because I tell you, I want you to ask me questions. It keeps us all honest and straight up forward. I'll show you everything I've done and everything I've found. And just like Teresa, we sat in the office, I said, let's call them. Let's confirm what we're doing before we send it out. And we did that.
Squire Carl, you're recognized.
Well, yes, and Freeman, it's just like we said, we had this conversation when the city came and the city PD came and did their budget. And again, the first responders, it takes each and every one of you on these calls.
It does.
It does.
It's a team effort.
It is. It is truly a team effort. And again, we as a community want the very best. We want to keep people.
And I think all of you do. I mean, and we're just trying to make sure that we get it out in front of you
Yeah.
to where we see those numbers because they're scary numbers. I get that. You know, it keeps me awake at night trying to figure out how to fix it. You know, what can I do? I can only talk to them so much to keep them around. You know, it comes down to how much can I take home to take care of my family, and I know that because I do the same thing with mine. You know, until I got in this position, I worked the same hours they did. I worked for the same pay they did. You know, it's amazing. I started out here at $3 an hour, 3 something an hour is what I started out at. And you know, I get it. I see the increases. You know, they see it.
That was a steal.
Yeah. And you know, they get it. My guys know it. And they appreciate everything you all do for them. You know, there's none of them on here that you're going to have that's bad mouth in the court. They understand us. They get where we're at. And again, I encourage everybody to ask your questions. Encourage you to come ride and hang out for a while. Go on a day-to-day basis with us and see what you see, hear the things you hear, and see the families suffering with the stuff that they have. You know, and I know you do, Marianne. You worked it for your full career. You see what that goes on in the hospital and the families. You know, the hospital money went from here to there because it had to. You know, so again, it's not something that I can control. And like I said, everything that I do, I think you all, my record should stand. I fight to keep the cost down on everything that I can. And this is just not something I control.
That's right. Other questions or comments? Any other members of the court? Anybody else on the committee? Is there a motion to recommend the EMS pay proposal to be presented in the fiscal year 24-25 budget? Motion by Squire Carl, second by Squire Gentry. Any other questions or discussion? Seeing none, all those in favor, please vote, signify by saying aye.
Aye.
Aye. All those opposed, nay. The motion passes unanimously, and pending any intervening factors, it will be presented as proposed in the budget. Thank you, Director Bailey.
Thank you all. Thanks for your
Appreciate
time.
your hard work on that and supporting and advocating for your employees. Thank you. Another personnel matter is that we moved to set the Assistant County Attorney's salary in accordance with salary increases as submitted in the budget. And we do the same for the Deputy Coroner's salaries. So we will just take up that matter in full court, but you all have seen the request from the County Attorney's Office and the Coroner's Office, and we plan to pass that pursuant to the statute in our full fiscal court meeting. That is the sum of our personnel business to come before the committee. Is there any other item or other personnel matter to be discussed? If not, I will deem us adjourned. We will reconvene after a short recess in the Budget and Finance Committee. Let's say 5 minutes. Thank you.
You know, it's great. Looks like you're gonna get.
All right, I'll call this meeting of the Woodford County Budget and Finance Committee meeting to order. We've got several department budgets that we want to go through. I'm going to get started with that to make sure we can move that forward. What do you got in front of you there, Squire Carl?
I have, the ambulance right there.
EMS Director Bailey, you had enough, or you?
What about you? Get ready.
Turn on your mic there. So, let the record reflect all members of the Budget and Finance Committee are present and accounted for, one being 1 year older than he was prior to this meeting. Happy birthday, Squire Taylor. Director Bailey, if you could, we'd like to go through your operation line items. We went through your personnel line items and go through and just kind of hit the high points, things that have changed, that sort of
Okay.
thing.
I can do that. 1 through 7, you all have already discussed just prior to this one. Line item number 8 is our ambulance billing. And that one has increased in went up in the line item there. And that's due to our increase in revenue. The more we bill and collect, the more that number goes up. So that's what that line item is. The numbers that I hit for you is the only ones that have changed. Otherwise, if they stayed the same, then you can ask me if you have questions on them. Line item number 11, ambulance vehicle repair. This increase is due to the cost of increase of inflation. What the mechanics are charging outside of the road department for things that they cannot repair and do, and they do a great job. They save me hundreds of thousands of dollars a year on repairs because of what it costs out there to have a big engine mechanic to work on it. The other thing is due to the increase in our run volume, we're running the trucks a lot more and they're starting to age and you just have natural breakdowns. That's the reason that line item increased like it did. And then the next line item is line item number 13, gas and oil. Same thing there. The reason that one I increased it a little bit is because the fuel prices keep jockeying up and they're starting to climb now. And our increased run volume. Again, we're over 4,000 calls a year and that's a lot of trips back and forth to Lexington. So the trucks are averaging about 8 miles a gallon. So, you don't see the trucks out running around a whole lot, just joyriding. Because of that, we try to maintain and keep them down the best we can. Line item 19, which is our ambulance medical supplies. This increase is due to the cost of markup. Every time every year we get a line item in and we negotiate that with our vendors to get the best cost, but their cost goes up and they raise the cost to us a little bit. Again, in the increase in run volume, the more patients that we treat, the more supplies we use. So we bump that line item to try to adjust with that. We just went to a conference this past week and we're working with other vendors trying to get that cost down and try to do things that we can to save money anywhere as we can on it. Line item 22, the ambulance building maintenance. The maintenance line is all the repairs that we do, the things that we buy for the service, that has to be done, trash bags or anything that we deal with that we have a cost with, cleaning supplies, all that comes out of that line item. Any maintenance to the building comes out of that line item. And it does have some items in it that is for the new Midway station, because we currently have a station that is running 12 hours a day. Nobody sleeps in it, nobody's there. And so with that building, we have added a few items in there that will make that station ready for the public. I do not see in that, just to touch on the Midway station, I don't see that being a large increase for us because our main cost is the personnel. And just to touch on that there, our personnel, it doesn't matter if we have a Midway station or not. I still have to have the 3 trucks because of the call volume. And it doesn't matter if I keep them at Big Sink or if I move them to any other part of the county. The great thing about this station, we was able to negotiate with Midway and work with them to where they're building the building for us at no cost, and they're helping us with that. The things that I have listed, just to where you know, because again, I like to be very transparent with what we're doing. I've asked for some money to put a signage on the front of the building that will show that it's Woodford County EMS, because being on the interstate, there's a good probability we may get drive-ups. Frankfort will only transport to Frankfort Hospital. So we get a lot of patients that drive their self from home in Frankfort or Owington County to Woodford County, because we will pick them up and transport them. So we want our building to be identifiable during the day and night. So as you all seen the signage on the front of Station 1, it lights up. We want that to be there because that's why we're there, is to take care of people. We had that yesterday. Frankfort called us for mutual aid, and I had my trucks out and told them we could not cover them. And the next thing we know, within 3 minutes, I have a call that they have a patient coming from the far side of Frankfort coming in that is profusely throwing up blood, large copious amount. Our crew meets them, and we transport that patient. But we get that a lot. So if they know we're on the interstate now, right there, it's going to be closer and quicker for them to come up the interstate to us. So that's why we want to mark that building. The other thing is in there is I've got beds, kitchen tables, some other furnishings that we do not have because we don't have a 24-hour service over there. So that's the reason we put that in there. Radio antenna, we've got that to put on top of the building, you know, to where we can do that. And then the other thing that we've asked for is a flagpole, just to be patriotic for our community because we're proud of who we are. And so that's in there. All that is covered in that line item. That's about an extra $21,000 worth of materials. And that's if I can't get them discounted down further. But that line item there is what that was for the building maintenance. My next line item that is increased is number 23, and that is the telephone. That line item covers all my internet charting and everything software, the cell phones, things like that, the internet, the cable TV for the crews to watch TV with and stuff. That went up just a little bit because we're putting that in the new station, but that cost has just been etching up at my Big Sink location and my Field of Dreams location at those stations. So that's why we bumped that number up a little bit there. The next one is line item is 25. That's ambulance travel. We increased that just because fuel costs went up a little bit. The other thing that went up is lodging. If you have to stay somewhere, it's amazing what they're getting for a hotel room now. But we've increased that a little bit because we do have people that go out of town for training and stuff like that, taking courses to keep them up on their training and things. The fixtures and furniture, that's part of that line that I just talked about on 27. 28, and that's to replace some of the old stuff at Station 1 or Station 2 that's been around for quite some time now. That station's starting to get a lot of years on it, so we have to update that every once in a while there. That's why the fixture numbers are there. 28 is the big ticket item. That's an ambulance. We had talked about having to replace a 2009 model, which is a 15-year-old ambulance. These trucks, like I said, our road department is second to none. There's nobody better at maintaining and keeping these trucks going than these guys. With the mileage on that, the hours on the truck, it's over 1 million miles. is what that truck has. So we just did the one truck that we got in from the accident, and with the accident and the help of Drew with FEMA, we was able to recoup that money. This truck is, that I've got cost fixtures in there, is to do a refurb truck, a remount to do it. And I was able to talk with a couple of the vendors. We went up to the show to discuss what we could get remounted and then the cost there. I did have one of the vendors that talked to me that told me that he feels that he can get me a brand new truck that they have as a demo that is coming off the line with my trade-in of this truck for around the same price what I'm gonna do a remount on. So if he does that, that's great pricing there. So if that number changes whatsoever, I'll let you know. But I do have some quotes from a lot of the vendors there and from the one that just did our remount. And the number that I have listed in that line item, the 252, will cover that for that truck. So once we replace that truck, we can buy a little more time, another year or two off of it. I've got two 2009s trucks, and again, the wear and tear is really getting them. And the older the truck gets, the more you use it, the more it breaks down. The more it breaks down, the more it costs. I've spent, I think, around $14,000-15,000 on one truck this year alone, just trying to keep it running. So that's the reason I put that line item in there. The next line item is the line item number 29. That's our ambulance office supplies. That decreased there. It's nice to hear that word decrease. We decreased that one due to the fact that last year we purchased a copier for us. And we don't have that expense in that line item anymore, so we pulled it out. But those are the ticket items that did change on our budget, and I'll be happy to answer any questions that you have about the budget.
I'd open up the floor for any questions for Director Bailey regarding the line items for the operations of the ambulance service.
What?
Squire Taylor, you recognize.
The line 31, those equipment cited there, that's not, is that a previous year that you were showing the uptick, or is that for those costs?
Line 30, when you're talking about the medical equipment,
Yeah,
that was the year that we purchased all those structures.
that's what I thought. Okay. I just wanted to make sure that that's what that note was. I thought, man, that's a real deal if we got that $5,000.
No, that's the year that we had to purchase all the
That's what I thought.
structures and things. And that's the reason the 5,000 there is just to cover like a vent repair or a pump or something like that we have to have.
Other questions or comments? I would just note that we've had this budget since March 26, 2024. Other than maybe some small changes, this is what you can expect in the budget, and we spent some time on it. So I'm hoping that when we get to this point of our line item review in the work sessions, that we can move quickly over this. So if you have any questions, please direct those to Director Bailey, but essentially that is where we are. Director Bailey, you've done good work. That's all we have for you. I'll move on to the road budget. Road Supervisor Bo Wilson had got called out to a tree down in Fentville, and he had to go, and that's how that works. So we will have Operations Supervisor Tracy Wright help us go through the line items on the proposed road budget.
The things that we have changes on, I bumped up licenses and service contracts just a little bit. Part of that was due to robotics. We won't have the large expenditure in the upcoming fiscal year, but I just wanted to make sure we had enough in there in case we just didn't. I don't know. Fuel Master is included in that line item, and they could always increase their contract fee for the fuel system. So I wanted to make sure we had enough in there without going over. Let's see. We dropped training down a little bit. However, we have plans to send 2 of our employees to get their CDL license. We did this for 2 employees out of this budget, and we would like to do it for 2 more. That gives us 4 new, young CDL drivers, and that gives them a little incentive to stay because it gives them a little more money once they complete their training successfully and get their license. Let's see. We dropped office equipment down, computer equipment and software, I'm sorry. We dropped it down a little bit. We're good as far as what we have in the office. Copier's good. Let's see. Garage supplies, we kept that the same. Road salt, we want to leave that the same, and I've spoken with the treasurer. We just want to keep that at 150,000 in case we have a bad snow. We were very fortunate this year. We did have to purchase 800 tons, which we've gotten the last of that. We have one more load tomorrow to be delivered, and we'll have fulfilled our contract with the salt vendor for this year. So that's good. On tires and tubes, we anticipate some tire needs for some of the bigger equipment. Those are very expensive. I mean, a tractor tire could be $2,500 or more just for one. Squire Brown, you know that very well. You know, the large loader could be $5,000 for one tire. You just never know. Maintenance equipment, that's my big one. We need to purchase a tandem dump truck without snow equipment and a single axle with snow equipment. We have gotten quotes from Bluegrass International, and I gave you all those at the last meeting. It's the same situation. We have to order them. We're not locked into taking them, and they won't be available for us to take delivery of until October of 2025, which is another budget year, which is the reason that we dropped that line item down to $250,000. But we need to be able to get that money funded back next year so that we can purchase those vehicles if you all approve the judge to sign the documents to get us in line for the trucks. If we don't get in line, then it's going to push it back, you know, another year. We've got dump trucks that are just rust buckets. We really need a new tandem dump truck. It won't push snow. It will truly just be to haul the big trees, the things that the current dump truck is just, it's almost getting to be a safety issue. Let's see, other than that, the LGEA money, since we didn't earmark it for anything at the last meeting, I need to put that back in there, and I just haven't. Other than that, I mean, that's really it. Nothing's majorly changed in our budget.
And Supervisor Wright, I'd just like to note for the record that the amount of LGEA is $6,905.43. I was reading the previous line item of $11,950.
That's correct. It is the 6,000. Somebody mentioned last meeting it was 11,000, and I didn't think that was right. One other thing, of course, we have not included salary information. I want to let the court know that I'm going to be retiring August the 1st. So we'll have to figure that out.
And Tracy did let our leadership team know that yesterday. I've been working with her on those plans. We're happy for you, but we're sad to see you go. You're such an integral part of the road department. And we appreciate all your hard work, always.
So we'll have to figure that out.
So that'll be something to be discussed in the personnel budget. But let me open it up for questions for the operations supervisor about the proposed road budget operations funds. Members of the Budget and Finance Committee? Members of the court, anybody else have any questions? Seeing none? Just threw that I'm going to retire bombshell on them and they got quiet.
I know. I've not seen you all be speechless before.
I thought about booing it, but I didn't want her to think that I was saying booing her,
Throw my
just
red
booing
glasses
the
in.
statement.
It's okay. Thank you.
So you all, any questions you have should be directed at Tracy and Bo on those operation line items.
Please
It's
call
another-
me.
Another budget that we've had for some time, so I hope that we'll be able to move forward on that in the budget workshop forthcoming.
We also have bid opening for paving on the 6th, so I'll have a little better idea of what we're going to spend on paving this coming year. Hopefully, it's not as much as I think.
Thank you, Madam Supervisor. I'd like to invite Director Drew Chandler to talk about the emergency management budget.
Thank you, Judge. Our department budget is quite a bit less complex than the prior two that you heard, so I'll try and keep this brief. You'll notice overall a significant decrease in our budget, and that is primarily attributed to, in the current fiscal year, we had a vehicle on a 5-year replacement plan, so that's gone in the upcoming year. Having said that, at the bottom of the budget submission, there were a few line item increases, mostly related to travel. And we'd like to be able to send our staff to some professional development trainings this year in a little bit greater volume than in prior years as we emerge from the pandemic. I'm happy to entertain any specific questions about the individual line items, Judge. I don't know if I need to go through each of those individually for you or not.
I'd ask the Budget and Finance Committee, what is your preference? I mean, I've gone over this multiple times, so it's, if you all need it for the review or you have questions, I welcome those. Squire Taylor.
No, I was just going to say, with those explained few exceptions, there's such minimal adjustments that it really explains itself.
I think overall, we're still less than 1% of the overall budget. So not a whole lot of moving parts in our operational side of things. Now, I don't think that we're getting into the grant side of things at this standing, but I am working with the treasurer to anticipate potential opportunities. We did submit 3 Homeland Security grant applications prior to the window closing yesterday. We got some good news from the FEMA reviewers on the initial park safe room project, which could be about $400,000 in revenue. So things are progressing. There's a lot of irons in the fire as always.
Thank you, Director Chandler, and this is a good time to remind anybody that any grants that you anticipate or seek to pursue need to be accounted for in the budget. And that goes for all our departments and agencies. And of course, Director Chandler also works on our IT side of the budget as well, helps us with that. So that'll be something that will be reflected in the budget as well. So any questions for Director Chandler? Seeing none.
Thank you.
We'll move on. One thing I would note is that there's a proposal to move the GIS department from planning and zoning to under the county to continue to keep the revenue from that consistent, that it would flow to the county instead of planning and zoning. And the expenditure line items of those have been submitted to you today. So that is the formal recognition of that. We're in discussions with both the cities and Steve in planning and zoning. I know he stepped out. But is it essentially the concept is essentially that it would be no additional costs or expenses on anyone, that it would be just a move from planning and zoning to under the county, which we did mention when we discussed the planning and zoning budget. Okay, so you have not seen this budget, but you have the maintenance budget before you. Director Wade. So Some of this stuff is conceptual, and we'll get to the point where we discuss that. But there are some big ticket items in this first draft of this budget. So Director Wade, if you want to.
Number 11, that's vehicle maintenance. That's up significantly. I have 2 vehicles in inventory. One we looked to put a snowplow on. It's become, we've used up the truck that we had a snowplow on. It's also deemed unusable, but it's up for gov deals. But that would be the truck I inherited from Bo Wilson at the road department. We also have an engine that's required in the maintenance truck, the box truck, that is a 6.0 that we're looking to replace. Moving on down to line 12, the custodial supplies, we kept that the same. The gas and oil, that has been increased just for the vehicle maintenance trucks. That is an increase. We've covered more ground. We're doing a whole lot more back and forth from job site to job site. The maintenance and repair, that's reduced significantly down to 170,000. We've pretty much touched everything but the restrooms here, and that's going to be next on my list. That also includes the generator maintenance agreement with Nixon Power, the maintenance agreement with Perfection for HVAC, and it also includes, this printing is terrible. I need a bigger printer, but I did not put that in.
Just need better glasses.
Yes, that's what it's for. The 2 fuel fills for the generator, and I figured that just a rough cost based on if we had to fill it 2 times in a year. Hopefully that does not come to fruition, and if you don't need it, you don't spend it. But that was for planning. The county clerk gov center, we're looking at a generator service for that. That will also require a revamp of the electrical system, with the service also being brought across the street. So that's going to be a kind of a costly item if we go into the service, but that's up for possible grant funding for that. Let's see. Utilities will stay the same at the Gov Center. We have some fixture costs is staying the same, and the satellite office equipment staying the same. The off-site repairs that come in a little bit lower, 349,000. That would include I had it on top of my head and I can't remember it. That would be the general upkeep of the facilities that include the stadium, locker rooms, the fair system, fair board, some of the outlying county park buildings. It would include the paving from up above the trailer all the way down to the pulling track, cleaning up that area, as well as some runoff water redirection.
So pretty much all that's in the county park?
Yes, ma'am. It does include, any outlying areas that we have. We have done some, to help Jack Jewett in their budget, if it was outside the facility itself. The utilities, we bumped 5,000 on it to 85,000 for all the utilities that we have out there. The lighting is one of the biggest costs. We did get changed in the parking lot of the Falling Springs to LEDs. I've seen a little bit of, drop in that, but I know where a lot of that is going, and it's in the stadium lighting, that the old style. So that will need to be looked at. Annex supplies are staying the same. The 911 fee, I'm not sure what it is. I just put $600, rounded it up. Annex repair, we're looking at that with a generator possibly. We had a freeze that took out our cooling tower, and it was a very difficult time. It was a great lead time. There were a lot of stuff that we had to try to mitigate to keep everybody cool. A lot of people were a little ill-tempered over it, and I don't blame them. But we're looking at correcting that action. We also have, it's not shown, but the bid opening will be tomorrow for the HVAC renovation project, tomorrow morning at 10. So that line should change, or could change, based on that. We also have a breakout that I'd like to discuss with anybody for a building at Falling Springs. I figured it in at 45,000 square feet building at $125 a square foot. That would be used for voting center, multipurpose, storage, event area. So that, there's a multitude of options. You could look at that. And that's my maintenance budget.
Thank you, Rick. And again, everybody's just gotten this today and you've gone over it, but I'd open it up for any initial questions that you have.
Thank you.
Thank you.
Please call me if you have any questions.
Yes.
What was the price of that square footage for that 45?
Figured it at 125 a square foot.
Is it?
125 a square foot. And I took that off our insurance schedule, and that was on the low end. So, but it also had some high security, roughly 5,000 square foot of high security built in it, so that you could, have your voting out there and have it locked down, that no entry into the building. And I do have I got it from Mr. Jim Burris. He had to step out of the project due to health issues, but he presented a very nice looking proposal and suggested, made his suggestions, and I hope we can talk about it in the future. Thank you.
All right.
Yes, we did have we will be receiving some funds in from the FEMA settlement on the barns. It was 200 and...
Pulling it up, we got it today.
That was a lot of work with Jordan, Emily, Drew, myself, with the FEMA people. And when you have Drew Chandler on your side, you've got a tremendous asset, because, as Jackie said, he knows his stuff, and he went to nose with FEMA representatives to get what we should be receiving.
258, 461, 65 cents.
Excellent. Read that number for the record, 258,000.
461
$461 with a 65 cents and change.
Outstanding job, Drew.
Thank you.
I walked in when he was working on it, it didn't look good then.
All right. So, you all have seen a good bulk of the budgets and line items. You're talking about well over 3/4 of the total line items excluding personnel that you will see, if not more than that. And again, the personnel line items will be sent to you at least 2 weeks before the first reading. My anticipation now is that at our next fiscal court meeting, May 14th, that we will meet as a committee of the whole to discuss the budget. I really hope that we'll have a lot of questions answered prior to that so we can move forward on that. The question then would be whether or not to move to have a first reading within that meeting or at the meeting after that, which would put us at May 28th, having the first reading, which does make it a little bit close to the advertising and submission of the DLG timelines. But if we need to have a second budget committee of the whole, then we can have that on May 28th. Any questions about the budget process and or the timeline? Seeing none. I want to move on to an item that is in the Budget and Finance Committee that we need to discuss, and that's the neighborhood grant programs. You'll see that one thing, Jordan was absent, but she was here on Zoom. And the one thing that I really, really appreciate about her administration of these grant funds is that she keeps the real-time spreadsheet for your review in the OneDrive at all times. So all of that is available to us in real time. And what we can see is exactly how much we have conditionally approved to be allocated. And we have 2 additional neighborhood grants, Oak Hill Estates and Eagle Crest. One thing that I'd like to do is have a little bit more narrow discussion of the neighborhood grant programs. Let me start out by saying that I believe in this grant program. Each and every individual that put their name on the ballot for magistrate, those that are successful and not, all indicated in the Woodford Sun questionnaire that they supported it, that you supported it. It has been a successful program by all accounts and metrics. I know that it's very much appreciated. It's been a great opportunity to partner with our neighborhoods to improve important public purposes, signs, lighting, other items in neighborhoods. And we've been widespread across all of the county, touching areas that have never received any money, helping out in areas in the city, in both cities, and we've done a great job with the program. The initial budget year, we spent just less than $40,000. In this current budget year, we allocated $40,000, and we have now, Jordan, as of today, the total expenditure, not the conditionally approved expenditures, the total expenditure as of today, do you have that?
$58,103.08.
Roughly $58,000. 59 if you want to round up. We are coming to a close in the grant window. As you all know, any grant received today would have to be taken up at the nearest opportunity, would be our next fiscal court meeting. Thereafter, we'd have to approve a grant agreement at another, which would add another 2 weeks out. And then we would have to administer the grant therefrom. So I know that Jordan would appreciate all of our magistrates following up regularly with our neighborhoods to see where they are in that grant process, because we are coming to coming to the closing end of this year's fiscal year and grant window. And all funds must be properly expended and verified by June 30th, which does give us a hard deadline on any of the expenditure of funds. And one of the things that will be absolutely certain is that no funds spent after that will be able to be eligible in the current year's grant application. Jordan, you can confirm this. We have we did receive a grant agreement,
2 grant agreements,
2 grant agreements, and what are those from?
Cedar Ridge and Hidden Away.
Hidden Away and Cedar Ridge. So we'll look at approving those in the fiscal court meeting.
Agreements.
That's agreements with the neighborhoods. While I'm on that topic, funding agreements, you all have seen some of the iterations of those agreements. The county attorney and myself are going to finalize a standard public purposes appropriation agreement. And the reason is that upon the recommendation of KCO's attorney, Rich Ornstein, any funds that we appropriate to outside agencies, we should have an agreement for that. And that was one of the things that we implemented with this grant program. We have a specific neighborhood grant agreement, but we will also be looking at doing agreements for all of our outside appropriations, which will be discussed probably after we pass the budget, because it doesn't need to be done necessarily until the funds need to be appropriated. So in moving forward, my understanding is we only have 2 of the 2 outstanding neighborhood grant applications that have been submitted. Again, that's Oak Hill Estates and Eagle Crest. My understanding is that if both Oak Hill and Eagle Crest were conditionally approved, and all of the neighborhood grants that have been conditionally approved achieve their full funding up until the fiscal year end, June 30, that we would be looking at an additional $7,446.26 to allocate to satisfy that amount of funds. Is that correct?
Correct.
Madam Clerk? So that is the full up and down of the neighborhood grant program. I don't really want to get into a discussion like we had last time. I'd like to move for some sort of solution. And I believe, Squire Gentry, you have a proposal for the Budget and Finance Committee to consider.
Yeah, I would like to propose that we go ahead and, or consider Eagle Crest and Oak Hill Estates for their grant application, and don't consider any more applications after that, because there's not enough time for anybody else to get an agreement and get approved. So that would be my recommendation.
So, Squire Gentry came to me with that recommendation. We talked about the timelines, which is, he's exactly right. We started conditionally approving neighborhood grant applications at this point. We could probably not only exceed the allocated amount, but put us in a position not to be able to fully fund the grant because it couldn't get the work done by June 30, which I think would be worse than the alternative, which would be to cease consideration of any additional neighborhood grant applications. Does anybody have any questions about Squire Gentry's proposal? Yep, Squire Taylor, you're recognized.
I just wanted to clarify, that would be, we would still receive grant applications, but we wouldn't accept them for conditional approval, or would it be no longer receive them? I guess I just want to make sure I'm understanding the...
It would be that we would no longer consider them for approval.
For this fiscal year.
That's correct. Is there a motion to adopt Squire Gentry's proposal to recommend that to the full fiscal court from the Budget and Finance Committee?
Motion.
Motion by Squire Carl. Second by Squire Blackford. Open up the floor for any discussion thereon.
I have a,
Squire Gill, you recognize?
I've talked to the 3 outstanding that are in my district and explained to them that it has to be completed and verified and bills paid by the 30th of June. I want to thank Jordan for working with Cedar Ridge on their procurement. Hopefully they can get that done. The question I have is Hidden Away. Their application included some electrical work that they found was not going to be able to be done because they have to tunnel under the road. So they were wondering if they could, and they sent in an amended application today they would just repair the irrigation system. We paid to do their landscaping at the front of the subdivision, but the irrigation system isn't working, and that would come in a little bit less than what they had originally requested.
Approximately $198 less?
Yes, something like that. So I don't know if we need to get approval from,
Can I just point something out with the motion for your recommendation? The second on that, Squire Lockley, I have members of the budget and finance committee.
I'll make that second.
Motion, second by Squire Taylor, thank you. Squire Gill, we'll take that up after the motion,
okay.
and if we need more time, we'll do it in full court, if you're good with that. All right. Squire Taylor, Squire Carl, you all have a motion on the table to recommend to the full fiscal court that we cease consideration of neighborhood grant applications following this meeting. That'll be a recommendation for a full fiscal court vote. So that's the motion on the table. Is there any other questions or discussion from the Budget and Finance Committee? Seeing none, all those in favor, please vote and signify by saying aye.
Aye.
All those opposed, nay. And the motion carries unanimously. Is there a recommendation to approve or to recommend the conditional approval of the Eagle Crest and Oak Hill Estates to the full fiscal court?
Motion.
Motion by Squire Taylor, second by Squire Varner. Seeing no discussion, all those in favor, please vote and signify by saying aye.
Aye.
All those opposed, nay. And then finally, there would be the recommendation to allocate the maximum possible additional funds for the neighborhood grants in the amount of $7,446.26, which may or may not include Hidden Away. It would, okay. Their amended amount or their,
A little more than the amount.
okay.
You can take $198 off of that.
Well, we'll leave it as what they've
Yeah.
conditionally approved, since this is a recommendation to the committee, but we would have the additional monies in there.
Motion.
Motion by Squire Taylor, second by Squire Varner. Is there any discussion? Seeing none, all those in favor, please vote and signify by saying aye.
Aye.
All those opposed, nay. The motion carries unanimously. That leaves us about 9 minutes to fiscal court. Are there any other budgetary items or matters to come before the fiscal court? Squire Gill, did you want a recommendation for the conditional approval of the amended Hidden Away Estates grant application?
Sometime, either now or during the,
I'll make that motion.
thank you.
And a second. Seeing no questions, all those in favor, please vote and signify by saying aye.
Aye.
All those opposed, nay. The motion carries.
You want to take up the grant agreements?
We'll do the grant agreements for full court approval. Done a lot of good work there this afternoon. Thank you all. There's nothing else to come before the Budget and Finance Committee. We will reconvene shortly in full court. Thank you, and we are adjourned.